Hello, my name is Sydney Reiser, and today I'm going to be presenting the social ecological model for the Cleveland Clinic. So the first thing I want to talk about is that I was born at Cleveland Clinic, and I've been going there for a long time now. And the first thing I want to talk about is public policy and just about like what Cleveland Clinic is all about and how it pertains to their patients. So at the first level, the local government, the Cleveland Clinic partners with the mayors, councils, law enforcement, and other officials to respond to important issues that impact the lives of people. So an example of this would be COVID. Um, and they're just wanting to impact people that live in communities where the Cleveland Clinic patients live and work. So their big commitment is heal, hire, and invest. You can kind of see the man pictured right there. And that is actually the Cleveland Clinic CEO, President Morton L. Mandel. And one of his most famous quotes from the Cleveland Clinic is that helping others to heal is our mission. Inclusion is a core value. Caring for the community is a cornerstone of our foundation. So, obviously, for patients, the local government has, the biggest direct effect on the patients, especially like with COVID and stuff, just with all the different mandates that were being made and stuff. Everywhere was different. And so just the Cleveland Clinic's ability to partner with the community that they're in and just to partner with all those mandates that were made and stuff is just an example of how it impacted the people and the patients. And then the state government, so they interact with the Ohio and Florida General Assemblies, the governor's offices, state agencies, and other Florida and Ohio public and private organizations to advocate for and partner on issues that impact hospitals, patients, and community members across the states. And then the federal government relations interacts with Congress, the White House, and cabinet agencies, notably the Department of Health and Human Services and the Centers for Medicare and Medicaid Services. And we've all heard of Medicare and Medicaid, especially, I know this especially helped my grandma out and stuff. She has been living alone for a long time, and having different federal government agencies like Medicare and Medicaid are just very helpful. The next thing I want to talk about is community. So, first of all, on the list, starting left to right, relationships among other organizations. An example of that would be Altman. I work for Altman, and I work in the MRI department, and so we a lot of the time have to do some investigating on people who have anything that's metal inside of them just to make sure that it's safe for them to have an MRI. And so a lot of the time we're sending releases to the Cleveland Clinic, releases for health information, in order to get that back and continue for the continuum of care for the patient that we are treating. And so it's just nice. Cleveland Clinic partners very well. A lot of the time we get the information back from them faster than we get the information back even from the patient or from other hospitals. And then the next is location. So they have multiple locations in Ohio and Florida. They have 276 outpatient locations. They have 23 hospitals, 6,690 beds. They have 80,642 caregivers, 5,743 physicians, and they have 16,536 registered nurses. Their resources include cardiology, concierge medicine, complex case reviews, cosmetic procedures, dermatology, executive health programs, on-demand virtual care, global patient services, a headache program, home health solutions, nutrition psychology, weight and lifestyle management, athletic therapy, chiropractic, concussion program, osteoarthritis program, golf movement screen, massage therapy, movement and performance, and physiotherapy. So they offer a lot of different things. I know my grandma, she takes advantage of those, as well as other people I know like to go there for cardiology procedures and stuff like that. I hear some good things about their cardiology department. The next part that I want to talk about is organization. So for hospitals especially, or this specific healthcare system or any healthcare system, safety is a huge priority, as it should be, especially with COVID and stuff. After COVID, safety's become a really big part of our everyday lifestyle in hospitals and other family offices. And I know specifically for me, I used to have to get physicals and checkups, and I still do. Or I used to get physicals and checkups at Cleveland Clinic. I'm with Altman now. But every time that a doctor would walk in, they'd wash their hands. Every time they walked out, they'd wash their hands again. Like, it's all very, very safe. And I even remember, like, the smell of cleanliness in there. You know how doctors' offices smell and stuff, but this especially, it was strong. And then the competition. So as I talked about earlier with Altman, they are friendly competitors is what I would say about it. So the way that they want to get patients is by gaining their trust and just being really helpful. They're not gonna, like bash other hospitals or anything like that. And they partner with us in helping us to, in the MRI department specifically for me, helping us to get information about a patient so that we can continue to help them. So the next thing I want to talk about is interpersonal. So the Cleveland Clinic has a lot of social networking going on. They have social media accounts, Facebook, Twitter, Instagram. They have the Cleveland Clinic website, which, by the way, is where all this information is coming from. They have so much information, more than you could possibly imagine. Information on diseases, journal articles, anything that you could possibly need. And then they have MyChart. So I'm not with the Cleveland Clinic anymore, but what's really cool is that I can still log into MyChart with the Cleveland Clinic and see all my past medical records. So if I had to, as it pertains to me in the MRI department, if I had an implant that I needed to look up and I was with Altman, but I used to be with Cleveland Clinic, I could still look up my implant information on my MyChart. Unfortunately, most of our patients don't know their login information and aren't able to do that, but I can still log into my MyChart and I could still look up that implant and have my care be continued at the hospital a lot faster. And then social media, this pertains to me. I mean, I'm a 19-year-old girl. I'm on social media a lot. So I know I used to follow the Cleveland Clinic because I've always had an interest in healthcare. So I have always liked just following up with them and just seeing what they're doing. And it's also a good way for them to get out, the different nonprofit things that they're doing, because the Cleveland Clinic does do a lot of sort of nonprofit things, which I think is cool. My personal doctor, my pediatric doctor, his name was Dr. Strong. He was such a good doctor. He delivered me and has been giving me my checkups up until I was 18 years old. Something that he's really, really good at is patient education. And he does a lot. He works with kids, obviously, it's pediatrics. And he is so good at educating, especially pediatrics kids in a way that they can understand and follow his direction. The next thing is personalized treatment plans. So my sister actually was very sick at one point. She was in the hospital for about 10 days. She was in critical care, and he took over, Dr. Strong for the Cleveland Clinic. He took over her care and really made her treatment plan personalized to her and what her needs were, and as well as what she's most comfortable with, like just as a kid, like still making sure she got adequate treatment, but was comfortable as she could be. Another thing I like about personalized treatment plans is when my mom, she had 3 kids there, they always listened to her birth plan. Some hospitals don't like to do that. They like to have their own way of doing things, and I get that that's for safety and stuff, but they really put in an effort to try and make, especially the birthing experience for a mother, personalized, and they tried their best to make it happen the way that the mom envisions it. The last thing is health screenings. I mean, that's just a general thing that most hospitals do, and like I said, I've been going to get checkups and screenings there with Dr. Strong, that pediatric doctor, for as long as I can remember. And that is it. So that is my presentation of the ecological model for the Cleveland Clinic healthcare system.